Dr. Kelly Oluoch is the Chief Executive Officer of the Kenya Medical Training College. Your time is well appreciated, Daktari. Thanks for making time on the broadcast for this brief discussion.
Thank you.
Then this is in relation largely to the Medical Training College's contribution to what the present administration, and has been the goal of every administration, is the drive towards universal healthcare coverage for Kenyans to access quality healthcare that is affordable. I mean, how instrumental are you in this journey for Kenyans to achieve that goal?
Thank you so much. About Kenya Medical Training College, this is a state parastatal under the Ministry of Health. Established in 1927, we have over 96 years of experience in training human resources for health. KMTC has 3 mandates. First, training. Second, research. And third, consultancy. KMTC produces over 85% of human resources for health in the country. In the just concluded graduation, KMTC graduated 22,695 graduates. Basically, this is very instrumental to the government in the bottom-up economic transformation agenda, in that we are then able to support primary health care and universal health coverage through provision of human resources for health who are skilled, who are available at community level, who understand the principles of primary health care, and who are going to improve the health indicators in the country.
And that seems to be very key, because the provision of 85% of the country's healthcare workforce, I mean, does this have specifications in terms of what number ends up in the private sector and the public sector? Because the public is where much of the attention is at the moment in terms of the quality of medical care and the required attention. So what percentage goes to each side?
We do not have proper statistics on what percentage goes where, but the available numbers are that we are capable of supplying human resources for public sector consumption and human resources for private sector consumption, including making available additional human resources for export. And so what we do at KMTC is calibrate requirements of counties with our training opportunities. We work very closely with counties to be able to know what kind of human resources they want, and calibrate our admissions and opportunities to support counties to do that. Additionally, we get requests from private sector, and we incorporate those in our training requirements.
One of the challenges facing the universal healthcare coverage is the shortage in terms of personnel. How do you intend of this 85% that you churn out to the market to be instrumental in the drive towards the goal of UHC?
KMTC has a new strategic plan that is 2023-2028, part of which is quality training. And in quality training, we are looking at also being able to supply the human resources required in terms of numbers to counties and private sector. So in the quality of training, we have emphasized on improvement on facilities, improvement on equipment, improvement on the number of lecturers that we will be having. And with this, we hope to create more opportunities for Kenyans to apply at KMTC, and create more opportunities for Kenyans to learn at Kenya Medical Training College, with the aim of ensuring that we have sufficient numbers being employed by the counties. Another conversation we are having is engaging counties on the importance of having appropriate numbers of human resources for health, on the importance of having stressing the primary health care kind of approach, and being able to supply human resources who are calibrated towards supporting primary healthcare.
And besides the provision of healthcare workforce that KMTC does, what other role do you play in terms of assisting with healthcare policies and setting up the systems towards the universal healthcare coverage goal?
We play 2 further roles. Number 1 is research. KMTC does operational researches that inform the curricula that we make in order to make them relevant to the changing needs of the healthcare environment. We also, out of this research, we get policy directions that we discuss with various stakeholders in order to make them possible to be implemented. Thirdly, we also do consultancy services. For example, we train for counties in terms of gaps that have been identified in the human resources for health that they have, and create curricula that are short courses that address policy issues. Eventually, we also do policy advocacy by interacting with policy makers at various levels to support policy directions that then create impact in the community and help the government achieve its agenda.
And besides being a leading healthcare training institution, what other roles can KMTC play in what appears to be a changing global trend in terms of healthcare?
There are several roles that KMTC is currently playing. Like there is great change in terms of technology that we are using right now. There is a need for supply of human resources for health at the global arena. And KMTC is now better placed more than ever to address the changing needs of global healthcare. Yeah. For example, right now, what we're doing in the institution is add additional requirements for those who are graduating, like add options for foreign languages like Arabic, German, and French, so that in addition to supplying local health workforce, then we are also able to supply global stage with human resources for health that are calibrated, fit for purpose for various countries which need human resources for health. So we have those kinds of discussions in order to not only supply our local market, but also be able to support global markets that need human resources for health.
The pandemic in 2020, and which started in 2019, literally inundated healthcare systems across the world. Ours wasn't an exception either. I mean, how does the institution that you lead play a part in terms of foreseeing such circumstances and be in a position to be a responsive institution that helps in our healthcare system and prevent it from a total collapse, as was the case witnessed when the pandemic had hit the world?
There are so many things that KMTC is doing in order to support the country in such pandemics. Just let me mention that in the pandemic that has just passed, KMTC played a very big role in converting its facilities into quarantine and isolation facilities. We learned a lot of lessons from being part of this discussion. Number one, we learned that the institution needs to be more adaptable, innovative, and be able to react to changing environments. We also learned as an institution that there is need for us to have curricula that address emerging trends. For example, in that period of time, we were able to support counties through development of short courses that will help us to prevent infections and transfer of those infections to other people. So with that, we learned that the institution needs to adapt to technology, and therefore, during that period of time, the institution experienced a big improvement in terms of the way we address and use technology. For example, e-learning platforms, skills lab that are technology driven, and basically use of internet to take advantage of scarce resources that we have. So as an institution, it made us to learn about adaptability of the institution, embracing of technology, and use of those technologies to help the institution grow going forward.
And primary healthcare revolves around holistic approach, and other than curative, also it focuses on preventive and promotive aspects of the goal towards universal healthcare coverage. What is then, for example, KMTC's role here in terms of providing holistic approach, which is well-rounded in aiding the delivery of that much touted goal that in previous administrations we have been unable to attain, but appears that there is a right footing now to attain that goal?
Okay, KMTC has ability to develop its own curricula. So we develop curricula right now that are focused towards the areas of preventive, promotive, and curative healthcare. And what we do currently is to make sure that our graduates are able to work at community level through rural attachments, working with facilities at community level, and being part and parcel of community-driven strategies that then help the country to address challenges before they become real problems in communities. So what we do as an institution is develop robust curricula that are adaptable, that make us be able to address the emerging needs at community level.
How key is the question of records of patients and this to forestall and have one systemized healthcare system where information can be accessed from all parts of the country? And how key is that in the drive towards attaining universal healthcare status?
One of the pillars of healthcare is information systems and the use of those health information systems to drive decision making at our facilities and at policy level. So having a unified way of collecting, and using information that are derived from healthcare provision is very key to such a country like ours. For example, number one, there's need for adaptability of that information to local needs of communities. For example, if the prevalence of disease in a particular area and has been collected through information that we get from our patients, and then it is collated and put together. The importance of that is that we have strategies that are specific to those communities, and then we're able to have designed health promotion strategies that are targeting such communities. We have interventions that target those communities, and therefore it costs the government less when we use that information to make strategies that are then able to be used for interventions for such communities. And therefore, information is very key. We cannot operate as a country without a unified information system in healthcare, so that we're able then to make decisions that are customized to communities that we serve.
And how key that information, the collation process of that information, of the language barrier that may exist or come into place, is that a barrier that can be addressed from policy perspective in terms of to drive towards getting the exact information that's required for accuracy purposes?
At Kenya Medical Training College, we have a course called Health Information Systems and Record Systems. In this, we produce professionals who are able to collect information that can be then translated to relevant communities wherever they are and wherever they are. And so what is important is being able to collect the right information, being able to synthesize that information and then communicate it for decision making at those contexts that the information has been collected. So what is key is the kind of skills that we have in terms of human resources that are able to collect that information, store it, and make sure that it is available for decision making, and then eventually be used for those communities to make decisions that are relevant. So we have cadres at Kenya Medical Training College, like the health records and information system, health promotion, that are then able to translate the collected information into package it into such a way that communities are able to consume that information.
Dr. Kelly Oluoch, the Chief Executive Officer of the Kenya Medical Training College, thanks for your time here and the brief discussion on the role played by the training college and its relevance to the goal towards the attaining of universal healthcare coverage that the government says will help in the alleviation of burden on the shoulders of many Kenyans in terms of financing aspect, the preventive mechanisms, and how this will be a primary healthcare system model towards up until the referrals, where the data will be collated for purposes of medical attention. Your time is all appreciated. Thank you.
Thank you so much.
Thanks to you too for watching the broadcast and waking up with us here on Daybreak. The hashtag on X has been Daybreak. The SMS code is 22422. Up next is Safin Achieng Oma. Stay tuned.